So we're glad you're here. Hope to see you again next month. And with that, I'm going to turn over to you, Kari.
Great. Thanks, Lena. Hi, everyone. It's great to be with you this afternoon. The sun is finally peeking through here. I live in Dubuque, Iowa, up in the northeast corner. I see a fellow Dubuquer is on the call today. And excited to share with you a little bit about what the Community Foundations Network across the state has been doing really for the past 10 years to explore their role in disaster preparedness, response, and recovery. And I think there are a lot of interesting intersections between your work and the work of community foundations, but probably more broadly, local COADs and BOADs, and how various community partners are coming together to think about those roles in mitigation, response, and recovery efforts. So I do have some slides that are really just to help keep me organized. So I will share those. I'll start by sharing a little bit about the work that has organized Iowa Community Foundations around disaster philanthropy. And then I'll close with just some information from the Center for Disaster Philanthropy and a program and initiative that they run called the Midwest Early Recovery Fund that looks a little bit more specifically at some of the realities that we experience with disaster here in the Midwest and specifically here in Iowa. So I will pop my slides up here and we will get going. Please feel free to share any questions in the chat or even come off mute if you want. Hopefully, we can keep this very informal. So you'll hear me say PREP a lot. I will never repeat all of these words again. I'll keep saying PREP because it's a really complicated name for a cohort, but it is the Philanthropic Preparedness, Resiliency, and Emergency Partnership. So you'll hear it called PREP. And we have been a part of this network for about a decade now. We being the Iowa Council of Foundations, but also some of our community foundation members. So just to kind of help you with the geography, the Greater Cedar Rapids Community Foundation, the Community Foundation of Greater Dubuque, and the Quad Cities Community Foundation have all been a part of this network for the past decade as well. And we are part of a cohort around about a 10-state region. And we've all come together to really explore the role of community foundations and disaster preparedness, response, and recovery, but also PSOs, which are what our organization is called, a philanthropy support organization. And so it's based on geography. You can think of it along the Mississippi and Missouri watershed regions. So those are kind of the states that are represented. And we've been convened by the Funders Network for Smart Growth and Livable Communities. And they have partnered with the Center for Disaster Philanthropy on the curriculum that we've been engaging in. And all of this work is funded by the Margaret A. Cargill Philanthropies, who some of you may be familiar with. So we first started this work in 2014, and the first step was creating what we call a PREP workbook, and it was designed to help community foundations really think about who the partners and players are in the disaster space that they need to get to know, or if they already knew those folks, how they could strengthen those relationships to be better prepared in this space. We do continue to learn. We've been doing this for the past decade and through specific webinars that PrEP coordinates. And then we do also have one in-person cohort meeting each year. We used to do it twice, but we're back down to one following the pandemic. And these learning from place site visits are wonderful opportunities to really see the lessons in action. So we see a lot of community development projects through mitigation efforts. We see response and recovery that's happened in communities. We've been all over this Midwest region, and we've hosted the cohort a handful of times in Iowa. We've hosted in Cedar Rapids and in Dubuque. And I have a secret plan to try and get folks to Marshalltown in 2026. So we'll see if that comes to fruition. Alongside all of the learning that we do, we also have two funding opportunities where community foundations and ICOF have been able to pull down some funding to support response and coordination work in our communities. I won't get into too many of the specifics of what community foundations have done with those resources today. I'll talk a little bit more about our work, but these could be some helpful questions for you to ask your community foundation, especially if it's one of those three that I named. But we are fortunate in our state to have at least one community foundation in each of our 99 counties, and I'll show you how to locate your community foundation if you don't know those partners yet. I can show you that at the end. So our goals of PrEP are to, of course, enhance the readiness of community foundations to be able to respond, to understand the range of resource and vulnerabilities in different community foundation service areas, and to develop operational capacity along with disaster grant making policies and processes. Those are really kind of the nuts and bolts that we dug into those first few years of PrEP is like, what's the role that community foundations can play in raising resources following a disaster and then deploying those resources to support redevelopment and rebuilding. Finally, we're working on increasing the knowledge of community-wide disaster management and the role of philanthropy in that work. So many of our community foundations are now active partners in their local VOADs and COADs. Some of them even lead or chair those groups. And that's been a real evolution and transformation over the last decade, to have philanthropy at that table kind of on the front end as opposed to coming in after a disaster impacts the community. I could go on for probably hours about the things that we've learned in prep, but I boiled it down to three really quick things that I think are probably the easiest things to take away from the conversation today. The first is that community foundations have important roles to play in coordination, preparedness, and mitigation. So we often think of money coming in after a disaster. We've seen a lot of community foundations really step up in coordination with their local planning departments, with their cities, with their counties, to leverage resources to support some of that preparedness work and mitigation work to hopefully alleviate the need for the raising of the money on the back end, or at least make it less of a need. We also have learned that community foundations can be the best partner to open and host a disaster recovery fund. We saw this numerous times over the last decade, and this has been a muscle that community foundations, kind of a thing that they could do, but a muscle that they've strengthened. So we have incentivized through some of our PrEP grant funded work, different community foundations seeding disaster recovery funds for their communities so they're ready whenever a disaster may impact a community. We also saw during the pandemic a lot of community foundations either start those funds or activate those funds to support that type of response and recovery to the pandemic. We also have learned that the unique role that community foundations can play with the resources that come from private philanthropic dollars is that the most important thing that they can do is to support long-term recovery. So we know that sometimes there's state assistance and sometimes there's federal assistance that comes through. Depending on the disaster, individuals and families that have been impacted may be able to get some support from their insurance companies. So once all of that is done, the most important thing that a community foundation can do is use their dollars to support those long-term recovery efforts. I mentioned Marshalltown earlier. They're a really great example of a community that's done this really effectively. Obviously, they had a tornado in 2019 and then a derecho in 2020. Their community has really aligned their disaster recovery fund resources with their broader community plan, their city master plan, and have been able to leverage those resources to support some really important community development initiatives in a strategy that is around disaster response and resilience for their community. So you kind of get a sense through some of those stories of the ways that community foundations have stepped up in this space. Wanted to highlight a couple things that we have done. We did produce an Iowa Community Foundations Disaster Philanthropy Toolkit, which is available for all Iowa community foundations. And frankly, we've shared it all across the country because we see many community foundations stepping into this space. That is a resource that can also maybe be helpful to you. There's lots of sample templates and marketing and communication strategies in there. So I'll share that with Lena. And if it can be helpful, please feel free to use any of those resources. More recently, we have also hired what we're calling the Iowa Grant Coordinator. Unfortunately, this is a grant funded position that will end at the end of June. But our grant coordinator has really looked at bringing different community-based grant writers together across the state and looking through opportunities that we may be able to jointly apply for to get more resources from outside of the state into our state. This work has been at this point kind of organized around the PrEP principles of disaster philanthropy and also environmental justice work. And you know, a lot of things have been put on pause that we were hoping to take advantage of, specifically at the federal government. So it hasn't been as fruitful as we were hoping. Best laid plans, right? So we will be reevaluating at the end of the year how we might be able to consider keeping some of that momentum moving forward when additional state and federal resources do become available again in the future. The final thing we've done is really just supporting network building. So obviously the three community foundations that are in the cohort have become well networked with the others in the cohort. But we've brought all of this learning back to the state of Iowa and all of the community foundations across the state, 130 in total. Now I'm going to talk just a little bit about the Center for Disaster Philanthropy and their Early Midwest Recovery Fund. The Center for Disaster Philanthropy is a national PSO or philanthropy support organization, and they work with national foundations, regional foundations, and private individual donors to support helping money get to disaster impacted areas. And one of their initiatives is the Midwest Early Recovery Fund. And they have had a couple of different staff people over the years. The first person was in Minnesota, and now their staff person is up in North Dakota. And we work closely with them through the prep cohort and have been able to connect that fund to several Iowa communities that have experienced low attention disasters. So that's really where the Midwest Early Recovery Fund focuses uh, their um, their efforts. So they have for that fund five key recovery challenges that they've identified as challenges in the Midwest and for low attention disasters. And I think that these are helpful to take a look at because they may help you think about some of the challenges that exist in your community and roles that you and your offices may be able to help support. So the first challenge is identifying and developing sufficient resources to meet the needs of those most affected by disaster. So, those low attention disasters don't always get state declarations or those federal FEMA declarations. And so, there just frankly can be less resources to support response and recovery efforts. And these are the types of disasters that affect our state the most. They also, low attention disasters develop long-term recovery efforts without additional support from national, regional, or state disaster organizations and partners. So those low attention disasters are not the things that make national news. They're not the things that sometimes at this point even make state news when, there's just a flurry of storms across the state and there's a lot of low attention disasters impacting a number of different communities. It's really hard to draw that national, regional, or state disaster response support and so that creates a lack of capacity in those communities. Low attention disasters, also, there's a real need for coordination of information and resources from multiple agencies. And a lot of times there's not capacity or resources to do that. There's a need to identify affected vulnerable populations and create appropriate resources to support them. And then finally, there's a really unique need in supporting children post disaster. And those low attention disasters really just increase the vulnerability of children and the elderly population significantly. So this fund was created to help communities with some, what I would call again, seed funding to get some of their recovery efforts started. And it was based around some of these assumptions. So there's this assumption that communities might be overwhelmed by responses from others coming in to try and help. But as I shared, if it doesn't get that media attention, that's a false assumption. And there may not be all of those partners coming in. There is, however, at a local level, a huge network of nonprofit responders and first responders that are already built into communities. And so the fund really prioritizes getting those partners organized and ready kind of pre-disaster. That's that VOAD COAD work that I mentioned. There's also a number of pre-existing community vulnerabilities, and the false assumption is that every community has an emergency management system. That is certainly not the case in our state. In fact, the legislature has had major concerns about rural emergency management. I'm sure that's something that y'all are familiar with. So there have been some efforts and some creative efforts to try and support some of these EMS and EMA services, but you certainly can't assume that every community has sort of a strength in that system. There's also individual vulnerabilities. There are a lot of false assumptions. We hear about this in the national media as well, that homeowners are insured, right? But that is not the case for all different types of disasters. And floods have been the most significant disaster impacting our state over the last decade. And account for about 80% of national disasters as well, and less than 10% of homeowners are insured for floods. So you see very quickly how these can create significant vulnerabilities for individuals. And then finally, there's individual responsibilities, significant unmet needs, how much is too much. We think about the kind of compounding effects of disasters on an individual's life, especially if an individual is already experiencing several vulnerabilities. Low income folks, folks experiencing mental illness, people living in poverty, elderly populations, children, which I've already met. As with any sort of income, or excuse me, outcome, as you think about those layered vulnerabilities and then adding a disaster in on top of that, it can really create some significant challenges for individuals in their response and recovery space. The biggest false assumption of all is that FEMA pays for that. And I think that this slide probably needs to be updated in the coming weeks and months, as there's been significant proposed changes to FEMA as an agency at the federal level. But over 90% of disasters in the US do not get federal aid through FEMA for individuals. And those FEMA max grants are not very big, right, for individuals to think about repairing, in some cases, their entire home and livelihoods. So, this is why disaster philanthropy is really, really important for all of the folks who make up the philanthropic pie to be engaged in. And that's why we've seen it as really critical to get community foundations engaged in our state. Without significant without significant recovery resources, people may leave the community, which results in all of these negative outcomes for your communities, or they may stay and start to develop a whole other host of challenges and experience other issues, specifically mental health issues, which I'm sure you're all familiar with the research on mental health issues related to disaster. But those are a couple that we wanted to just call attention to. So disasters can also create opportunities, and I think that's what the preparedness and mitigation work has made community foundations and our office most sort of energized around, is this opportunity to do that front end work to be better prepared for the back end work. So just wanted to share these. I'll get the slides over to Lena so you can take a closer look at those things if you would like to. They maybe help pull with some of that case making and urgency building work that is important to get folks energized around disaster preparedness. We know that's always a challenge if there hasn't been a recent disaster or a community doesn't maybe know or understand the importance of this work. Some of these case making things can be really helpful. Wanted to leave you with 5 things that you can do at your organizations that may help you sort of with your own organization's disaster response work, or building connections with your local community foundations or VOEDs or COEDs. So the first thing you can do is review or update your own continuity of operations plans. This was another key thing that our community foundation partners, and now as a result, a number of our other ICOF members, private foundations, United Ways, other types of partners as well, have also started making sure that they have those coops in place. If you need a template or some help getting started, please let us know. That's something that's in our toolkit. We would also encourage you to speak with local elected officials so that they know what your office will and won't be able to do to help with disaster response. And this is an important thing that you can share with other community partners as well as elected officials. We also would love to see you making sure that you're engaging with your local and state emergency management officials to know what their plans are and how your health department strategies can fit into that. We would encourage you to contact current community partners and encourage them to think about assessing their own organizational impact. So maybe you work with other partners that are really key to your disaster response. Like we know community action agencies play a really critical role in our state. Make sure that they have their own continuity of operations plan as well. That's another way you could help support them. And finally, consider hosting community meetings or joining your local VOAD or COAD if you're not a part of that network already. Those would be really great tables for you to be sitting at and engaging in conversation because as I've illustrated with the community foundation piece, right? Like we know our part, we know the philanthropy part of this equation. We really rely on all of the partners at the table to bring their knowledge, their expertise, and their lived experience to help support this critical work, especially at a time where disasters are increasing both in frequency and severity. So I will leave it at that, Lena, and I would be happy to answer any questions you might have or any questions that folks have maybe shared in the chat.
Great, thanks, Kari. Every time we talk, I learn something new, and I will admit that
Oh,
community
sorry, Lena, I couldn't
foundations.
hear you at first.
Oh, can you hear me?
Now I can. Yep.
Okay. No, I was to say every time we talk, I learn something new and a new opportunity for partnership because I will admit that community foundations are not the first place I think of when I think of partners for public health, but we should. Just a real quick question. You said VOAD and COAD a few times. Can you
Yes.
what are those acronyms?
Yes. Oh, great. Now it's a quiz. I'm teasing. Voluntary organizations active in disaster, and I believe
Okay.
COAD is community organizations active in disaster. So they may just be called that, like your local VOAD or COAD, or sometimes they may have a name, like the one in Cedar Rapids is called LAP Aid, for example. If you need help figuring out who those folks are in your region, just shoot me a note and I can put you in touch with the state coordinator who brings all those groups
Okay.
together.
So those are official groupings.
They take many different shapes and forms. So if they are a formally established VOAD or COAD, they do have a bit more kind of structure and support around them and how they operate, and like the money flows a little bit easier to help support some of those organizations. But they don't always take that formalized approach. It could just be more of a community coalition of folks working in those areas. So it's one of those answers of like, it depends on where you live, what that looks like. And it also depends, which one you look at, how kind of strong they are in terms of the relationships that they've built. We have communities, especially in the prep cohort, who have unfortunately a lot of experience in disaster. So Cedar Rapids lap aid that I mentioned, they're really good at what they do because they've had a lot of disasters impact their communities. And the Community Foundation has just continued to increase their engagement in that work. And now a Community Foundation staff person actually chairs lap aid. So I think that the lesson that we've learned over and over again is you don't want to get good at disaster response, but it really, really helps when you have people with longer tenure who've done this year after year, and people really know their roles and understand the effective roles that they can play in the coalition to support their communities. And the VOAD and the COAD can be kind of the most helpful container to do that.
Okay, good. That's helpful. So one kind of a segue from that is a lot of our well, all of the local public health departments and partners host tabletop exercises for
Yes.
preparedness. It sounds like that's something that either your community foundation or your VOAD or COAG should be invited to. Are you seeing that kind of partnership in any local communities or that kind of those tabletop exercises?
Yes, we have had a number of community foundations, specifically those in prep, who've leveraged some of those implementation grant dollars that I mentioned to do um, active trainings together with their local VOADs and COADs. And I know that public health departments have been a part of those in some specific cases. What I would say though, if there are specific things that happen in your world that you think community foundations or other partners should know about, community foundations are kind of natural conveners in communities, so they're a great partner to reach out to help get some of those tabletop exercises in front of other partners or even community members. I think that's always really, really helpful to have like the broader community familiar and understanding some of these roles as well. So I'll actually pop in the chat a website that we host that if you don't know your If you don't know your local community foundation, excuse me, we do host this website, iowacommunityfoundations.org, and it has an interactive map on it where you can click on your county and then be connected to your local community foundation. So that would be another great place to start in building those relationships if you don't already have those. And if an e-introduction could be helpful, I'll also pop my email in here and I'd be happy to help facilitate that as well.
Thanks. I think it might be helpful just a quick 101 on community foundations, kind of what they
Yeah.
are, what's
I
the magic
realized
behind the
that about
curtain, right?
halfway through my remarks. I
That's
probably
all
should
right.
have started there. So we'll end with the beginning, if you will. So community foundations are community-based organizations that are supported by donors living in a specific geography, and they use donor resources via grant making or donor advised funds to deploy resources to communities. We really think about community foundations playing three important roles: that direct work with donors to raise resources for their community, the grant making work, which is redistributing those dollars into their communities, and then the third role, which is the role that I've talked the most about today, which is their community leadership role. So, how are they identifying specific issues in their communities that philanthropy may play a unique role in helping address, and how do they coordinate partners around those issues and help lead to community change around given priorities? So, the community leadership work, as I said earlier with the BOADs and COADs, it takes a lot of different shapes and forms too. But if you hop on your community foundation's website, you should be able to find some information around the priority areas that they're focusing on. I'll give one example. Muscatine is a community that just did a bunch of community organizing and visioning around their work. And they've had a very specific focus on housing, but they've had their public health department and their local hospital and health clinic deeply involved in that work because we know the importance of the intersection with the homeless community and health needs and outcomes. So, those are just some examples of the types of work that you might see them involved in. But every community foundation looks a little bit different. And because we have one community foundation in each of our 99 counties, we have some that we call host community foundations that are accredited through national standards, but we have more that are what we call an affiliate community foundations that are somehow connected with a host community foundation in their region. And those may be all volunteer run. They might have a part-time executive director. They may have a 10-hour a week secretary. They all look a little bit different, but they are all actively engaged in securing resources for the community, deploying resources for the community, and thinking about the leadership role that they can play.
So I'm going to ask you now to look into your crystal ball, which I
Oh,
I know we love doing. Um, so we know that our behavioral health districts have already kind of
yes.
shifted boundaries and aligned across the state, and we know that public health is looking at the same sort of districting in the next few years. What's the future for community foundations in that regard? Are you all also looking at districts? And or how as I mean, some of the folks on the call, I'm sure, work with their behavioral health districts. Lots are involved in public health and will be involved in the public health districts. When we think of the district approach, how does that change how we might build relationships with community foundations?
Yeah, such a good question. In some ways, community foundations are already working in a district approach, though the districts will not line up with like the districts that you all would create because the reason our host affiliate relationships were created actually happened 20 years ago with the creation of the County Endowment Fund program. And essentially, some community foundations had been around a little bit longer and had capacity to take on more affiliates. And so it just ended up being like who had the capacity to help support those affiliates. So Des Moines Community Foundation is a host, for example. They have like 40 affiliates. Dubuque is a host where I live. They have 7 affiliates. So it all looks a little bit different. And then we also have some standalone community foundations. So it's not a neatly organized map, but it does kind of exist in that way already because of those host affiliate relationships. In terms of thinking about how best to partner with your community foundations when those new districts are kind of emerged and in effect, I would think about really building cross community foundation collaborations. So instead of approaching each individual community foundation around partnerships, I would ask for joint meetings to say, this is what we're experiencing in this region. These are the priorities that we have. Could you explore like a joint funding proposal as opposed to going to each of those offices? I don't know really what the future of that looks like because, well, the crystal ball isn't that clear, but I do think it's worth the conversation. And that's actually one that we hear community foundations kind of already starting to explore as there's been some regionalization of other, other priorities in the state as well. We also have really stressed to our community foundations, especially those in rural communities, to really embrace the idea of regionalism because no county has everything that they need, no city has everything that they need. So that's certainly a thread that we've been pulling, and I think that it will tie nicely to the work that you all will be doing and sort of reorganizing and reimagining how you're doing your work in partnership with different regions. So I think that's a wait and see because there needs to be some more conversations. But I would certainly ask the question about how to make it easier on you all to access resources and partnerships from multiple community foundations.
Great, thanks. Those are my questions. I'm wondering now if or invite everybody to unmute. If you like, ask Kari questions. She's put her phone number or her email in the chat there for really specific in the weeds kind of questions about your particular situation. But happy to have the conversation continue for another bit of time. Oh, John says in the chat, we prepared a guidebook and training materials on rapidly restoring access to communities and properties affected by disasters. And oh, great, he shared the material that others can benefit from. Thanks, John.
Amazing, John. I'll share that with our community foundations network too. Appreciate it.
I actually do have a question for you, and that is, there's been a lot of talk about building back better, although so a lot of times the pressure is to build back exactly what was there before.
That's right.
What role do you see for community foundations in kind of fostering that conversation?
Yeah, I see a lot of community foundations actively involved in those conversations already. And in fact, we just hosted a meeting last week with a national speaker who has really coordinated some national dollars for other cities across the country. We wanted to like learn from what they've been doing. It's a process called Reimagining the Civic Commons, and I think you all would find it interesting too. So I'll share it with Lena as well. But the concept is like if you're investing in community redevelopment or community development projects, how are you making that a space that supports civic outcomes for your community? And the research is really, really compelling about kind of what those communities have seen as a result of working in that coordinated and deliberate and intentional way in building their community spaces. So, I wanted to highlight that because we see a lot of these community initiatives with a lot of partners coming together around the table around a specific thing that either community foundations are leading or they're a central part of that conversation. And it certainly is, my experience has been, it certainly is not about like rebuilding what we've always had. It's really an imaginative and a creative space to build something that is designed to meet current needs of residents. And I think the reimagining the civic commons, like the essence of that idea is exactly that. So I'll pop the website in the chat so you can take a look at that. But they also have a whole host of tools and even they kind of gamified it with a card deck to help interrogate some of these questions. But I think it could be really helpful for a variety of different community projects. I'll mention Muscatine again. The community foundation has been really central in their Mulberry Health Clinic project. And it has not just been a community foundation thing or a health clinic thing. It has been a community-wide initiative to really think about the services, the amenities they needed to have available at that health clinic and how it connected into the broader community and some of their housing initiative work as well. So I do see community foundations who are doing it well, really bringing fresh eyes and perspectives in this. And it's not just their ideas, right? They have really strong community engagement strategies as well.
And I'll just piggyback on that. Another partnership example. If y'all were with us last month for our lunch and learn conversation with Cody Smith with Iowa Environmental Council, Kari, Cody, and I, well, and all our organizations are all working together on that project that was highlighted last month and shared. And the idea is that we can bring that work to our respective partners and broaden that net. If you missed that conversation, it is available on our YouTube channel. We'll put the link in the chat in just a few minutes here. But other questions you might have for Kari? Kari, I'll ask one. Were there yesterday was signing day? I don't know if I said that right or not at the legislature. Signing day, I think it is. Which means last day. What kind of legislative impacts are you seeing that will affect your work and consequently,
You
the community work?
usually that's not a long answer, but this year it actually happens to be a little bit of a longer answer. So I mentioned our work to support community foundations. For the last 20 years, it's been organized that we support community foundations through a state contract that we've held, and then we support also our broader network, which is inclusive of community foundations, but also corporate grant makers, private philanthropy, et cetera. So that state contract, as of yesterday, will be eliminated. So we will be reimagining some of our work and specifically in partnership with community foundations, really figuring out what the path forward is for supporting community foundations, both at the host and affiliate level, related to two state legislated programs that we have historically helped market and administer, the Endow Iowa Tax Credit and the County Endowment Fund program. Iowa Economic Development Authority will take over some of those responsibilities, but they won't be doing all of the same things that we were doing. So we just need to have some time to like reimagine the role that we play, what makes sense for us to continue doing. So we're in a bit of a visioning a new chapter space as an organization. Additionally, that same bill, it was a large tax credit bill. There were several other things in there as well. But that bill did cut some funding from the Endow Iowa Tax Credit Program down from $6 million every year to 3.5, and it added a handful of other rules around the program that will work in partnership with community foundations to help implement. Um, the Endow Iowa tax credit, for those who don't know, is a 25% state of Iowa income tax credit to donors that give to an endowment fund at an Iowa community foundation. That fund those funds, the 6 million every year helps generate at least $24 million in private philanthropic investment into endowment funds, which will grow in perpetuity to support communities. It's been a really, really popular and effective tool to support community-based development and community-based philanthropy in our state. So we're grateful that it will remain intact, though not at the $6 million level at 3.5. We also do have a program called the County Endowment Fund program that benefits 84 counties across the state who do not hold a state issued gaming license. Those counties receive about $140,000 each year to support their communities. 25% of that goes into their local county endowment fund, and the other 75% goes out through a competitive grant making process. So I'm sure many of you have probably applied for grant funding from those programs over the years, or at least worked on community partnerships that have drawn on some of those funds. So that program is alive and well, though there have been a number of things in the gaming space from a legislative perspective over the last few years that of course impact gaming revenues, which is the way that the resources for that program are generated. So those are some things that we're keeping our eye on. That those are the like very specific program things. There were also a number of things related to changes in tax law at the local and state level. We're also watching a lot of things federally right now related to charitable giving and 501(c)(3) status. So it's been a very busy time for our sector. Nonprofits broadly, but also philanthropy, are facing some really unique challenges in not necessarily doing their work, but really building the case for the impact that their work has in communities. So it's work we do a lot with maybe with donors or directly with communities to say, like, this is the impact that we're having in your space. And we're having to do that in a very different way with lawmakers at this point.
Well, I'm sure when it comes to helping to build the case, I mean, that's where, again, these partnerships between public
Totally.
health and community foundations are natural, even if they're not intuitive. But hopefully now there's greater recognition of that. So thank you for being here, for presenting today. I mean, we still have time for more questions, but while people think of that, I do want to remind everybody that this is a virtual space that we gather every month on the third Thursday of every month. But we do have, IPHA does host in-person meetups as well. And we have one coming up this summer. It's our 4th annual day at the park, where with the iCubs and the Cedar Apple Kernels, you can gather with other public health friends and just have a nice day at the park and enjoy the sunshine. Maybe a hot dog and a beer if that's your thing too. But we do all this because we are your membership organization. And as I said before, if you're not yet a member, we invite you to join and support this work and the advocacy work and the education work and the professional development work that we all do too, like the ability to bring Kari to you and learn about community foundations. So Kari, thanks again for all the information that you've shared with us. We will send out those slides and resources. We'll make those available to all of our members, not just the ones who are here today. I know some of you had to join late today. If you want to make sure that you catch up on the conversation, that's available on our YouTube channel. Kim put the link in there, just a couple chats up. We'll share that again though. But again, thank you, Kari, for being here with us. Next month, we'll conclude our 2024-25 series. And we will be joined by Catherine Harrington of Iowa Community Action Council. So you won't want to miss that one either. We are we're building out our 25-26 program year. And so if you have ideas, if you would like to speak and present your work, this is really just an informal opportunity to share the great work that we're doing across the state. So please be in touch with that. And of course, if you would like to get more involved with planning our programming and things like this, you can certainly join us with our education committee or any of the other committees that we do at IPHA. Just get in touch with us, myself or Kim. Our emails are our first name at iowapha.org, and we can get you hooked up. So again, thank you, everybody. We'll see you next month.
Thanks, Lena.
Thank you.